The COVID-19 pandemic has been a part of our daily lives since March 2020, but with vaccines still in development, more than 160,000 new cases a day in the United States, and the US death toll at more than 240,000, it remains as important as ever to stay vigilant and know how to protect yourself from coronavirus. According to the Centers for Disease Control and Prevention, CDC, the best way to prevent illness is to avoid being exposed to this virus. Here are the simple steps you can take to help prevent the spread of COVID-19 and protect yourself and others. Know how it spreads. Scientists are still learning about COVID-19, the disease caused by the coronavirus, but according to the CDC, this highly contagious virus appears to be most commonly spread during close, within 6 feet, person-to-person contact through respiratory droplets. The means of transmission can be through respiratory droplets produced when a person coughs or sneezes, or by direct physical contact with an infected person, such as shaking hands, says Dr. David Goldberg, an internist and infectious disease specialist at New York Presbyterian Medical Group Westchester and an assistant professor of medicine at Columbia University Vagelos College of Physicians and Surgeons. The CDC also notes that COVID-19 can spread by airborne transmission, although this is less common than close contact with a person. Some infections can be spread by exposure to virus in small droplets and particles that can linger in the air for minutes to hours, the CDC states. These viruses may be able to infect people who are further than 6 feet away from the person who is infected or after that person has left the space. These transmissions occurred within enclosed spaces that had inadequate ventilation. Finally, it's possible for coronavirus to spread through contaminated surfaces, but this is also less likely. According to the CDC, based on data from lab studies on COVID-19 and what we know about similar respiratory diseases, it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. But this isn't thought to be the main way the virus spreads. Infographic showing how the new coronavirus spreads. How contagious is coronavirus? A person infected with the new coronavirus can spread the virus to 1.5, 3.5 people. This metric, known as the R0 or R0, describes how contagious a virus is. Here, we show how quickly the new coronavirus can jump from one infection to over 1 million. Practice social distancing. Since close person-to-person contact appears to be the main source of transmission, social distancing remains a key way to mitigate spread. The CDC recommends maintaining a distance of approximately 6 feet from others in public places. This distance will help you avoid direct contact with respiratory droplets produced by coughing or sneezing. In addition, studies have found that outdoor settings with enough space to distance and good ventilation will reduce risk of exposure. There is up to 80% less transmission of the virus happening outdoors versus indoors, says Dr. Ashwin Vasan, an assistant attending physician in the Department of Medicine at New York Presbyterian Columbia University Irving Medical Center and an assistant professor at the Mailman School of Public Health and Columbia University Vagelos College of Physicians and Surgeons. One study found that of 318 outbreaks that accounted for 1,245 confirmed cases in China, Only one outbreak occurred outdoors. That's significant. I recommend spending time with others outside. We're not talking about going to a sporting event or a concert. We're talking about going for a walk or going to the park, or even having a conversation at a safe distance with someone outside. Wash your hands. Practicing good hygiene is an important habit that helps prevent the spread of COVID-19. Make these CDC recommendations part of your routine,